Hi, let's do a quick test of your knowledge. It's called a syringe selection Fast 5 quiz. Your first question. A patient has an order for a 0.4 ml medication to be administered by a subcutaneous injection. So which syringe should the nurse, you, choose to administer 0.4 mLs of medication? You have several options here. I want you to look at each one and look at the one that was going to give you 0.4, that type of measurement. And I'll pause and wait. All right, have you made your choice? Let's see if you were right. The correct answer is C. Here's why. The 1 ml syringe would be appropriate to measure a 0.4 ml dose. Let's look at the syringes again. The one on A is a 5 ml syringe, and the hash marks are 2, 4, 6, 8, and 10. So you could probably do a 0.4. It would be right about here. Whoops, sorry. Be very difficult to measure. You could do it if you didn't have any other choice, but the best choice is not this 5 ml syringe. You want to use the smallest syringe as possible because you'll get more accurate measurement. The 3 ml syringe doesn't work because, well, it does because it's in 0.1 measurements. So here's the 0.5. You could do a 0.4 here, but again, it's not optimal when you actually look at C. Now, why isn't D okay? Because this is an insulin syringe. How do you know? Well, first of all, it doesn't have mLs on it, and there are no points like 1 point, or it looks like it could be 10 mLs, but it's units, and your secret is down here at the bottom. It says units. So C, you can, on this 1 ml syringe, the large markings are your tenths. So here's your 4/10 of an ml right here, much more accurate to be giving something that's less than an ml in a 1 ml syringe. Here comes your next question. A patient has an order. Okay, it stopped me for a moment, but it's the same type of dosing. A patient has an order for a 0.4 ml medication to be administered by sub-Q medication injection. So you've picked your syringe, but now when you're choosing your equipment, which needle are you going to choose to give this subcutaneous injection? You have 4 choices. You have a 1-inch 23 gauge, a 1-inch 25 gauge, a 5/8 inch 25 gauge, and a 3/8 inch 23 gauge. I'll let you spend a few minutes thinking, or a few seconds thinking about it. Have you decided? Let's see if you were right. The answer is C. So an appropriate size needle for a sub-Q injection is 3/8 to 5/8 with a 25 to 27 gauge. C is the only answer that is appropriate for both the length and gauge. Let's look back. So 1 inch, yes, you could give a sub-Q injection with a 1 inch. You just would not go in all the way. You couldn't go in a full inch because now you're giving an IM injection. But when you're looking at all of your options, the first thing you want to do is cross out 1 inch and 1 inch when you have shorter needles available. Then you want to look at what you have. And this 23 gauge on a 3/8 inch, which would get you into the subcutaneous tissue, 23 is pretty big for an injection like this. So 5/8 is going to get you into the subcutaneous tissue, an appropriate gauge needle so as not to cause discomfort for the patient. So we're going to give 0.4 mLs of medication with our 5/8 inch 25 gauge needle. Where on this syringe would you mark the level of medication? So where along all these hashes is going to be the amount of medication you will draw up into this syringe to administer to the patient. I'll give you a few seconds. All right, are you ready? Let's see if you're right. Here we are. Where this blue arrow is indicates the level at which you would pull up your medication. Right here at this long line that goes to the 0.4 is where you should draw up to your medication. So now, a little bit of difference. We're done with that injection. And now your patient has the following medications to be administered at 9 o'clock in the morning. Which medication cannot be crushed? Now, right now you don't have access to that do not crush list. But something here is going to help you understand which meds can or cannot be crushed. I'll give you a few seconds. Are you ready? Let's see if you were right. The answer is B. Let's go back. B is aspirin EC, which means enteric coated, 81 milligrams PO. The EC means enteric coated. This medication cannot be crushed because the coating must remain intact. Medications that are meant for sustained release or enterically coated to take them through the gastrointestinal, the stomach and into the small intestine, they're meant to be broken down in the small intestine rather than the stomach. That's why they put an enteric coating on there, because sometimes they can be very irritating to the mucosa in the stomach. So if they can pass through and get into the duodenum and into the upper portion of the small intestine, the enteric coating starts to dissolve there and they're absorbed in that location instead. But we cannot crush these types of drugs because then it disrupts the coating and the purpose for them being coated. One last question. You've received an order that says now. That means you give it now. A now order for potassium chloride, 40 milliequivalents PO now. Because this patient has difficulty swallowing pills, the nurse chooses the following liquid potassium. And that is absolutely within the nurse's purview to make that choice. You are not changing anything about the order. This is still a per orum or PO dosing of potassium. You don't have to call the provider and get permission to do this. So now on a potassium, on a cup, a medication cup with 30 mLs, you need to mark the appropriate level. I failed to give you a cup here to mark. But on the next page, we are going to look at where that mark would be. So let's look at this label. This is your potassium chloride, and he is to get 40 milliequivalents. That means you want to give 15 mLs. So let's take a look. Here's your cup, and there's your 15 mLs. And the rationale again is the order is for 40 milliequivalents, which is equal to 15 mLs. So you notice, you've probably seen these cups. If you haven't yet, you will for the rest of your life. They're very common in nursing practice. And they don't have milligrams on them or milliequivalents. They are only in milliliters. So that is why you need to know when you're getting 40 milliequivalents, how many mLs that means. So if your patient was supposed to get 20 milliequivalents, that means you would need to give 7.5 mLs. You cannot measure on this cup that we're looking at 7.5 mLs. There will be some cups in your practice that will have enough hash marks that you can do that between the 5 and the 10. I've shown you here an oral syringe that most oral syringes only go up to 3 mLs because you don't really want to squirt more than that into somebody's mouth. Some might have 5 mLs. None will have 15 mLs. Someone can swallow this easily, but to squirt it in is going to be a lot of volume to do that. So you can't pick a syringe for this dose of medication, even though the title of the quiz was syringe selection. You will have to use a dosing cup for this. One thing you can do, if this is a bottle, is you can draw it up with a syringe and measure 15 mLs and put it into a cup, or draw up 7.5 mLs and then put it into a cup so that the patient can then swallow. That's the end of our Fast Five. I hope that you got all those answers right. If there was something that confused you, I suggest going back into your textbook and reviewing some of your dosing and how you calculate doses and select syringes. Good luck, guys.